Did you know that people with diabetes are at increased risk of infections and ulcers in their feet? Here are some important tips on how to care for your feet in between your medical appointments. First, you should make it a habit to get to know your feet and check them for changes every day. If you make it a habit, it gets a little easier all the time. Here you see that Faustino is checking his feet. He is carefully checking between his toes. This is important because that hidden space between your toes is where cuts, cracks, and fungal infections can start and often go unnoticed. Many people have trouble seeing the back or the bottoms of their feet. Here you see Maria using a mirror to check her feet. Make sure you have plenty of light so that you can see well. Another helpful technique is to put the mirror on the floor, as Don is doing here. This is more comfortable for him, and he can clearly see the bottom of his feet this way. Of course, if you have a family member or friend who can help you check your feet, that is wonderful. Maria's husband is looking for any cuts or sores, blisters, calluses, swelling, redness, or anything else that looks out of the ordinary. That is why it is important to check every day. Notice that he is checking the bottom of her feet and the tops of her feet and in between her toes. Another very important step in your routine is to wash your feet every day. Make sure the water is not too hot so you do not accidentally burn yourself. And of course, it is important to dry them well. Nick has a special seat in his bathtub. It is easier for him to sit and wash his feet well when he takes his daily shower. He is very careful to use a soft washcloth and soap and then rinse his feet well after he cleans them. Nick dries his feet as well as he can while sitting in the bathtub. Then he is very careful as he steps out of the tub. He steps onto the towel to dry the bottom of his feet. You can see that his slippers are right there waiting for him. He puts on his slippers before walking to the bedroom. Nick never goes anywhere barefoot, not even from the bathroom to the bedroom. Nick's wife Kathy helps him by drying in between each of his toes and checking for any cracks or sores or fungus. It is very important to keep that space between your toes dry. Also, please be careful never to use any creams or lotion in between your toes. You can ask your doctor to recommend an antifungal powder if you need one. Kathy puts moisturizing lotion on Nick's feet and legs every day. She is always careful not to get any lotion between his toes. Don likes to use a chair and a basin to wash his feet in the bathroom. We recommend everyone sits down to wash their feet to avoid the risk of falling. That also helps you do a better job. Don is careful to dry both feet thoroughly and also make extra sure he dries in between his toes. After his feet are nice and dry, you can see Don putting some moisturizing lotion on his feet here. And, as always, he is making sure none gets in between his toes. Another very important part of taking care of our feet is to make sure that the shoes we wear fit us properly. Shoes that do not fit well can cause irritation and create problems. We also want to be sure to always wear socks with our shoes. Don is showing us a very good habit here. Before putting on his shoes, notice that Don is shaking out his shoes. He is checking inside them to make sure there is nothing in there that might hurt his foot. Remember, if you have some nerve damage from diabetes, you may not feel something in your shoe. It could poke you or rub on your foot and cause a blister or a sore. You will also see that we are checking the fit of Don's shoes. There should be plenty of room for your toes to spread out and not rub against the inside of your shoes. Always try to get your shoes properly fitted by a professional or have them checked by your doctor. Like many people, Nick has trouble reaching his feet. This can make putting his socks on more difficult. Nick has come up with this special device to help him put his socks on by himself. These and other tools are available if you are in a similar situation. Ask your doctor to help you find the right tools for you. Nick also uses a shoehorn to help him get into his shoes. Many people also find a shoehorn very helpful. You can also see here that Nick's shoelaces are elastic and have a special clip so he can tighten his laces without having to tie them. This is helpful because he has limited mobility in his fingers. Our last rule for keeping our feet safe is never go barefoot, even inside your own home. So, whether you are just walking from the bedroom to the living room, or from the living room to the kitchen, or stepping out to the porch for just a moment, or out for a walk in the neighborhood on a sunny day, never go barefoot. Always protect your feet. And please remember these final thoughts. Daily inspection means early detection. Find small problems before they become big problems. If you miss a day, don't dismay. Tomorrow is a new day, and you can give yourself some grace and get back on track. And lastly, when in doubt, get checked out. If you see something concerning, get help. Your doctor would rather see you for something small than have you let a small problem get bigger.